Hello, I'm Dr. Jeff Smith, author of the book Living Pain-Free, It's Your Choice. I'm a board-certified doctor. We practice neurological and metabolic medicine. It's talked about in the book I wrote, Living Pain-Free, It's Your Choice. We have a website dedicated to our office. It's called www.thechronicpainclinic.com. thechronicpainclinic.com. If you go to that website, you can see some more of the videos like you're watching here and learn quite a bit more about what it is that we do. I literally wrote the book on fibromyalgia treatment, and we're going to discuss that right now. What is fibromyalgia? Fibromyalgia, as you know, if you're watching this video or if you're watching it for a family member or someone you know that has it, is a very, very serious and debilitating disease. It attacks the joints of the body. It attacks the brain. It causes fatigue. It causes pain. It causes fogginess of the brain where you just can't think straight. Insomnia, sleep disorders. Even food tastes bad with fibromyalgia. So let's talk about how you can get rid of that, how you can eliminate that from your life. I'm sure you've taken pills, you've taken Lyrica and prescriptions and things like that, and all of which have basically failed you. You can't take Lyrica, you can't take the sleeping pills, you can't take the pain pills and expect to get rid of the problem. All you're doing is treating the symptoms anyway. That doesn't do any good. Why don't you try getting rid of the actual problem? So let's talk about it. How do you finally end your chronic healthcare fibromyalgia nightmare? What makes us different? Well, number one, we literally wrote the book on the subject. Okay? We know what to do. We treat our patients metabolically and neurologically. Now, what does that mean, metabolically and neurologically? Neurologically, that means we treat the brain, the central nervous system, the nerve endings of the body. Has any doctor ever talked to you about any of those things with your condition? I doubt it. Okay? Metabolically, what does that mean? Well, we're going to look at blood work. We're going to look at chemistries. We're going to look at the values in those. But we're going to look at it a little bit differently than what your doctor has before. I'm here to tell you, we are going to leave no stone unturned. No stone unturned. Metabolic treatment. Well, we base that on specific lab panels, which means tests. Now, you've all had tests. I know I've heard it before. We start with simple tests like thyroid panels, a complete metabolic panel, a lipid panel, which is your fat, your triglycerides, your HDLs, LDLs, a CBC with auto differential. Now, I know you're going to come in and you're going to say, Doctor, I've had all the tests. They said it was normal, right? I'm here to tell you that may not be the case. You see, when the laboratory does an analysis of a patient, let's say it tests your thyroid, for instance, okay? Thyroid's very important in fibromyalgia. The lab will say between 0.5 and 5 is a normal range for thyroid, okay? That's the laboratory normal. So your doctor will look at that and say, okay, well, you're at 3.4. You must be normal. Your thyroid's fine. And you'll say, well, doctor, why am I still sick? Here's why. The laboratory range is 0.5 to 5. Do you know what the functional range is? Another word for functional would be optimal. Optimal range. The optimal range is 1.8 to 3.0. So if you're a 3.4, you're not in optimal range. In fact, you're too high. All right? Your thyroid's too high. So if you don't look at the lab results from a functional or metabolic perspective, you're never going to get well. And that's what we're going to do. We can assess your thyroid, your adrenal glands, your liver, your kidney, your red and your white blood cells, your gut function. All these tests have a profound effect on a chronic healthcare condition like fibromyalgia. Sensitivity, for instance. We do what's called sensitivity testing. Now, why would that be important? Okay? If you as a fibromyalgia patient are sensitive to soy, gluten, milk, wheats, okay, yeast, eggs, those types of things, any one of those things, if you're sensitive to those at all, you're going to cause inflammation not only in your body but in your brain as well. Okay? What types of things will you experience if you're sensitive to those things? It's very simple. Chronic pain or fatigue. If you have fibromyalgia, we know you have chronic pain and fatigue. However, sensitivity to those things can also cause frequent indigestion, heartburn, bloating after you eat. You ever eat and wonder why I just don't feel good? Okay? Frequent bowel movements, loose bowel, constipation, ulcers of the mouth or tongue. I have a patient, fibromyalgia patient, her tongue is fissured. It looks like the Grand Canyon from ulcers. It's terrible. And it was because from age 5 on, she was sensitive to gluten and her doctors never knew it. Why did they never know? They never thought to run the test. Because they don't treat patients neurologically and metabolically like we do. Vomit. I have another patient. Her teeth absolutely fallen apart. Why? Because she's vomited since she was a teenager. Every single day. Not a day went by she hasn't thrown up. Now you combine that with fibromyalgia and you're going to have an awful bad day. Alright? Adrenal stress index. That's a test we run. Okay? It checks the adrenal glands. Your adrenal glands have 2 primary functions. Alright? Number 1, your adrenal glands are your stress glands. They sit right on top of your kidneys. Now, we all have stress. I know. If you have kids, if you have a job, you're going to have stress. Alright? How you deal with that stress is what's important. And your adrenal glands are the one thing in your body that does. It deals with stress. Okay? However, if your adrenal glands aren't working and you can't properly deal with stress, what's going to happen to your body? Well, what happens when you have stress? Your blood pressure goes up, your hormones go crazy, okay? You gain weight, you feel terrible, you can't sleep, okay? That's all because the adrenal glands aren't working. The second function of adrenal glands, and a lot of people aren't aware of this, is it regulates blood pressure. When your blood pressure goes up or down or just flip-flops all the time, it's because your adrenal glands aren't working properly. Not because you haven't had enough blood pressure medication. Okay? Your doctor hasn't checked your adrenal glands. The only way to know is through the tests. Okay? In fibromyalgia patients, the adrenal glands are extremely important because they release a hormone called cortisol. If cortisol levels are too high in the brain, you're going to be wide awake at 3 o'clock in the morning and dead tired at 3 p.m. in the afternoon. And if you have fibromyalgia, you know what I'm talking about. Autoimmune disorders. What is an autoimmune disorder? Well, that simply put means your body is attacking itself from the inside. Okay? It's eating away at itself. How do you know if you have an autoimmune disorder? It's simple. You run the test. Okay? So what test do you run? Well, for instance, fibromyalgia patients suffer from chronic pain, chronic fatigue. Thyroid. Let's talk about thyroid again. There are antibodies. They're called TPO and TPG. Okay? If those antibodies are too high in your bloodstream, you're going to suffer from what's called Hashimoto's disease. And the primary symptom of Hashimoto's disease is fatigue and weight gain that's unexplained. Hashimoto's disease is where your body, because of the autoimmune disorder, is attacking its own thyroid gland, preventing it from working. Okay? In thyroid patients, it's extremely common. In fibromyalgia patients, they all have it. Okay? The only way to know if you have those antibodies in your body is to run the test. Do the proper tests. Okay? Further blood work is needed sometimes to look at the immune system. Why would the immune system be important in fibromyalgia? Well, if you can't fight off disease, if your body's attacking itself, your immune system's basically in the toilet. Alright? You got to check for it. Lymphocyte subpopulation panels, Th1, Th2 cytokine panels, natural killer cell activity panels. Those tests have to be run to give me an in-depth picture of what your immune system is doing. What's actually happening inside of you. Okay? Because if you suffer from an autoimmune disease, that absolutely trumps every problem you have. Everything. It's the most important thing. It has to be fixed. If that's not addressed, you will not get over your condition, no matter what it is. Alright? That trumps it all. Another thing we test for is called H. pylori.